Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the channel. We are discussing multiple choice questions from external here. This is the part 3. Links for the topics which are being covered in these sessions are there in the description. So you can check out the detailed topics individually from those links. So let's start today's discussion. You are requested to like, share and subscribe the channel. A 35-year-old cold water swimmer presented to ENT department with bilateral hearing loss, and examination revealed multiple hard swellings in deep part of the external auditory canal. So what is the most probable diagnosis? So hard swellings in deeper part of the bony meatus in a swimmer, most probable diagnosis is exostosis. All are true of osteoma, external auditory meatus, except single, often pedunculated, seen in cold water swimmers, arises from cancellous bone. Osteomas are single, often pedunculated, and they arise from the cancellous bone. But in cold water swimmers, usually the exostosis develop, which are also bony swellings, hard swellings, but they are multiple and they are present in the deeper part of the deep meatus or bony meatus, while osteoma, again, it will be there in the deep meatus, but it will be single and it will be in the lateral aspect of the bony meatus. Most common benign tumor of external auditory canal is osteoma. All can be there, papilloma, osteoma, serominoma, adenoma, but the most common one, benign tumor of external auditory canal is osteoma. Now, osteoma and exostosis, as I just mentioned, osteoma is usually single tumor. It is composed of cancellous bones located at outer part of the bony canal. In contrast, exostosis is multiple, more than one. These are composed of ivory bones and they are present in the deep meatus. Usually they are 3 in number, and their etiology is cold water swimming. So hearing loss if the external auditory canal is obstructed by the large bony swellings, either osteomas or exostosis, and if wax is impacted there. So if they are asymptomatic and on routine investigations, routine examination, they are being revealed, so the patient should be under observation and no active treatment is required. But if they are obstructing the external aortic canal, then excision, surgical excision is the treatment of choice. These are few pictures of all these diseases. Exostosis, as you can see in the picture also, that exostosis, they are multiple. They are more than one, as you can see here, 3 in number, 1, 2, 3. While this osteoma, it is single, and this osteoma is more laterally placed as compared to these exostosis, which are in the deeper part of the deep meatus. This is hemangioma outside, and this is serominoma. 42 years old diabetic male developed left ear discharge and pain. He also noticed facial weakness. On otoscopic examination showed granulations in the external auditory meatus. What could be the cause? So diabetic male with some discharge and earache, and on examination when granulations are there, so the cause will be malignant otitis externa, which is also called as necrotizing otitis externa. What is not true about malignant otitis externa? It occurs in elderly diabetics. This is true. Granulations are seen on the floor, especially at osteocartilaginous junction. Yes. It is locally malignant? No. This is not a malignancy or neoplasia. Actually, this is an infection. If untreated, cases may involve base of skull and parotid gland. Yes. It can affect the facial nerve. Yes. Not only the facial nerve, but it can involve other cranial nerves also at the skull base. So the odd one is C, that it is locally malignant. No, it is not a neoplasia. Then why it is labeled as malignant? Because behavior wise it is just like any malignancy. And what is the behavior of the malignancies? That they are invasive, they cause the bone invasion, bone erosion and bone destruction. Same this infection does. Malignancies can involve the cranial nerves. Similarly, cranial nerves can be involved in this infection also. So basically, this is an infection caused by Pseudomonas, but behavior-wise, it is just like any other neoplasia. That's why the term malignant otitis externa is coined. A 60-year-old male, again with uncontrolled diabetes, presented with severe earache, blood-stained, purulent right-sided ear discharge, and ipsilateral 7th cranial nerve paralysis. CT scan of the temporal bone shows spreading osteomyelitis with bone destruction. Which organism is responsible for this disease? So this is a case of malignant otitis externa again, and malignant otitis externa is caused by Pseudomonas aeruginosa. Common cause of hearing loss is, all these diseases can cause hearing loss, but the commonest one is wax in the external auditory canal. In oral syringing, the syringe is directed, it is directed into posterior direction. Posterior direction. Because posterior wall is shorter and we should not directly throw the fluid or water used for syringing on the tympanic membrane. So the direction is posterior. Ear wash is indicated in caloric test. Yes, in caloric test we use the water. Foreign body removal. Sometimes syringing can be used for the removal of the foreign bodies. Atomycosis and wax. Yes, it can be used for the removal of these. But when there is central perforation, then that is contraindicated. That is a perforation in the tympanic membrane is a contraindication for oral syringing. Ear syringing was done for removal of wax in ear. During the process of syringing, patient complained of severe vertigo. What is the likely diagnosis? Thermal stimulation of the semicircular canal. This is the oral syringe. This is made up of metal. Its capacity is 50 to 100 ml. It can be used. Then it has got different shapes of tips, detachable tips it has got. This tip is there. So these are here with the screw, so it can be detached, and according to the need, different shapes are available. We can attach this nozzle here, and this is how it is going on. Posterior direction, and the fluid along the roof it goes, and tympanic membrane should be intact because perforation in the tympanic membrane is contraindication. So fluid will go, which we will inject through this syringe, and then from the tympanic membrane the fluid pressure will be raised here, so it will come outwards into the this kidney tray, and wax or foreign body or any mass, soft mass, if it is there, it can be removed from the external auditory canal. So this is the technique of ear syringing. Now, in the previous question we saw that if patient feels vertigo, that is due to the thermal stimulation of the external auditory canal, the semicircular canals. And how the thermal stimulation will be? If the temperature of the water which is being used for syringing, that is not on body temperature. If it is hot or cold, it will cause thermal stimulation of the semicircular canals and patient will feel vertigo. So for syringing, the temperature of the solution should be at body temperature. Body temperature is 37 degrees centigrade. In contrast, the fluid which will be used for caloric test, that fluid will be 7 degree above and 7 degree below normal body temperature. So it will be 30 degree and it will be 44 degrees centigrade, because there we have to check the integrity of the labyrinth. So we want to stimulate the labyrinth. There our purpose is to stimulate the labyrinth, and labyrinth can be stimulated by thermal stimulation, which can be caused by use of hot and cold water. While in case of syringing, our aim is just to remove wax or any foreign body from the external auditory canal. We don't want to stimulate the labyrinth in oral syringing. So here we will use the water at body temperature, that is 37 degrees centigrade. Vegetative foreign body in the ear, the treatment is with, it should be removed with fine ear hook. So it should be removed manually. We should not use the syringing, because if it does not come out, what will happen? It will absorb the moisture from the water which is being used for syringing, and it may swell up. Similar case with alcohol, and with suction also it cannot be removed if it is of a larger size and it is fully fitting in the external auditory canal. So we should use the ear hook to remove this foreign body, and maybe under general anesthesia and under the microscope sometimes. So with that, we come to end of today's session. You are again requested to like and subscribe the channel, and thanks for watching.